Welcome to another episode of Noble Thoughts. Today we're talking about infant mortality. Most people don't even realize that Indianapolis ranks 7th in the country for infant mortality. That means more babies are dying here before their first birthday than in most other U.S. cities. Dr. Nicole Carey is the director of Cradle Indy, a new organization working to change that. Dr. Nicole Carey, thank you so much for joining us on this episode of Noble Thoughts. You're from Indianapolis. This is your home community, and you're doing a lot of work around infant mortality. How did you get into this work?
Well, I love my city, and we're known for lots of really great things, but it is not the best place for a person to give birth. And I have 5 babies, and so that truth for me was really important. So I did all the research with my first pregnancy. I watched documentaries. I interviewed my OBGYN just to make sure that I was going to have the best experience, and I did. I had a really great experience. I had my family with me and my friends, and I felt really prepared. But in 2020, I was pregnant with my 4th baby, and during the pandemic, you weren't allowed to have any extra people in the room with you. So it was just me and my partner, and I love him very much, but he was just not the only support that I wanted in the room. And so I was recommended to hire a doula, and I had that privilege of being able to hire a doula, and it was a life-changing experience for me. She cared for me and nurtured me in a way that I had never experienced ever, and I didn't really know that I deserved that. And in addition to that, she advocated for me in a way that I thought I was advocating for myself, but it was times 10, times 1,000, and really made me feel safe and cared for in a way that I think that all pregnant individuals deserve, and especially Black women.
Why is it that many Black women are not working with doulas?
I think there's a lot of reasons why that happens. One, it is sometimes cost prohibitive. So doula care is not always covered by insurance. Actually, it's rarely covered by insurance. Even though there's evidence that shows that doulas reduce cesarean rates, doulas make better outcomes, more likely. Another reason is, I think, just education. I didn't even know what a doula was. After all of that research that I had done, someone had to introduce me to the concept of a doula, when in reality, if you go back 100 years, doulas were very common in the Black community, in midwives. That is how we birthed our babies for centuries in community. And so education is one thing, but also having access and having that extra income to be able to hire a doula.
And so that's kind of where Cradle Indy comes into play, right? Tell us about the work that you guys do.
Absolutely. So if you don't know anything about all of the things that are available, there is a lot out there. There are lactation consultants, there are midwives, there are your OB appointments, there are mental health professionals, and all of the things that come with a pregnancy. It's very overwhelming. Where are you going to get childcare? Where do you find help for this? Where do you get a crib and a car seat? And a lot of times, you're just too busy to call 10 or 11 different places to get all of the care that you really need. And so Cradle Indy is going to be that center, that hub, that brings everyone doing really great work in our community together, so that a pregnant person can call and become a part of our network, part of our community, and we can give you all of the resources in one place. We're not here to duplicate services. We're not here to create great programs, because great programs already exist. We want to connect you to what's out there and make sure that you're getting all of the care that you need.
Talk to us about the people that you're connecting with, and what are some of the systemic challenges that are causing this high rate of infant mortality here in Indianapolis?
Well, in my opinion, one of the greatest challenges is fragmented care. You have silos of service where you have great work happening here or great work happening here, but they're not talking to each other. And so I give the example of a child. Imagine someone is pregnant and goes into their child care provider and drops off the baby and says, Miss Lisa, I'm pregnant again. Are you going to have space for an infant in about 6 months? And imagine if she was connected to all of the different places that person would need, and say, well, hey, why don't you call this doula? And then the doula is then connecting that person to maybe food assistance at the local community center and making sure that they get into an OB early in the first trimester. And then the OB says, well, maybe you had a traumatic experience during your first birth. You should maybe see this mental health care professional. In all of that, those folks aren't talking. None of those people understand the impact that they've had on that person's life outside of what they are doing. But it is a network, it's a web of care. And if we are just following the person, if we had person-centered care as opposed to service-centered care, then we would be able to tell that story better, and we would be able to make sure that person got all of the care that they needed in a holistic way.
What are some of the common misconceptions about infant mortality?
That it is the pregnant person's fault. You know, there are a lot of reasons that it happens, but the number one reason in Indianapolis is because of perinatal risk. It is a risk of a mom during pregnancy. So making sure that you get into an appointment early is very, very important, and that can be challenging here in Indianapolis because we have a shortage of healthcare professionals.
Research shows Indiana's infant mortality rate is 20% higher than the national average. Dr. Carey, what are some of those common misconceptions about infant mortality here?
I would say one of the misconceptions that I hear a lot is that it is the fault of the parent for infant mortality. Either they didn't do something or something was not enough. In most cases, that's just simply not the answer. We know that the causes for infant mortality in Indianapolis specifically are risk during pregnancy. So the best thing that can happen is getting early access to care, which is difficult because we have a shortage of maternal health care providers in Indianapolis as across the nation. And so it's really important for us to coordinate our care, incorporate home visiting, different strategies that are rooted in community to make sure that we're taking care of all of our mamas.
You know, Cradle Indy hosts events and they get people together to have conversation. How do you incorporate the voices of grieving families at the events? How does this help in your mission?
Well, I think we do that in a couple ways. One, we're not just looking to incorporate the voice of the community. The voice of the community is what drives the work that we do. The planning of Cradle Indy happened in community. So Cradle Indy was modeled after Cradle Cincinnati and a few other national models. But the model of care doesn't look like their model of care. It's different because our community decided in those conversations what we need to focus on here. Doula care was one of those things that rose to the top of the list of what people really wanted to see more access to. So we definitely want to make sure that it's understood that while we are, while we are seeking many stakeholders to be involved, we're seeking lots of folks to be a part of this puzzle. The voice of the community is always going to be the primary voice that guides our work. The second thing is we are looking for people to tell their stories. Oftentimes, stories are exploited for specific reasons, but we as a community need to heal together. We need to understand that we are in a medical crisis. This is a community crisis, and it's not getting enough attention. We only get there if we can tell our stories. I think a lot of times people have traumatic experiences during their birth experience, and then they just move on. They keep it moving because that's what you have to do. But it's very important to take the time and tell those stories and share so that the next person knows that that's not okay, that that's not normal, and that we deserve better.
For people that are just now finding out about these facts and they want to do something to help, what should they do?
Well, we have lots of levels of involvement. We have a program called the Community Bridge Project, And if you are interested in becoming a community bridge, that's someone who is linking people to childbirth education. Actually, we're looking for salon owners or faith leaders, early child care providers. Even if you're not in this field, if you are a part of the community and you love your community, come and be a part of our community so that we can bridge those worlds. We also have our storytelling ambassadors, and so if you want to be trained in asking questions and doing interviews or taking short videos of the people that you know and love and getting their stories out there, we're collecting those stories. And we also need our fundraising ambassadors. So if you're willing to raise funds for us, if you're willing to host a micro event, there are lots of ways that we can get you involved.
To those people at home, they're saying, oh, this is a problem for the young people, or this is not really my issue. What do you have to say?
Well, like I've said many times, healthy babies mean healthy communities. And when you have one of the highest infant mortality rates in the nation, that's a scary predicament for a community to be in. It affects our education, it affects our workforce, it affects our economy greatly. And so when we come together and we can take care of our pregnant individuals and we can take care of our babies, then everybody is going to have a better community.
Dr. Nicole Carey with Cradle Indy, thank you for joining us and thank you for sharing your noble thoughts.